In the state of Arizona since 2008, we are seeing a 235% increase in the incidence of neonatal abstinence syndrome in our babies in the neonatal intensive care units. So this is just impacting everyone as far as taxpayers, families, babies, all of us. When these babies are born, they're the tiniest of addicts. We will treat the babies and help them withdraw, but in that process we really need to make sure that the family system is trying to be as cohesive as possible. We'll work very closely with the Department of Child Services, and our ultimate goal is to make that an intact family system. I think by also partnering with other family organizations is going to be huge. Making sure that when these babies are discharged from the hospital, that the parents have the resources to meet their needs. Coping is hard. Taking care of a newborn is difficult. Taking care of a newborn baby that has NAS is beyond difficult. When we send them home to their house with their parents, sometimes it's single moms, sometimes it's a whole cohesive family system. Not always are the coping mechanisms fabulous. We hope to give them these tools, also make it that other organizations, they're intact or they're in contact with them and they know where to get help. If they can't get their baby to stop crying, who else can they go to? If they're a single mom in their home all by themselves, there's no one else. We want them to know that this is who you can call. There are resources here in the state of Arizona. That's one of the things that TAP AZ has told us, and my gosh, our eyes are open. We work in the healthcare facility, for greater than 20 years, both of us. We don't know about all these organizations. There's so much out there that we can do better, and that, by giving them that network of people, will make a huge impact. Hopefully make it so these families can really, really recover.
It doesn't do any good to treat the baby for addiction when you're not treating the whole family for addiction. It really is a process that needs to encompass the entire family for full recovery to take place. Our goal is full recovery for the entire family unit. And addiction is not just about abusing medications or heroin or opiates or whatever your drug of choice is. It's what caused you to do that in the first place. We need to treat that. We need to get to the bottom of why is this person using, how did they get here, and really start at the source. That's the best thing for the whole family. So we really want to work in partnership with the organizations that treat the moms, that treat the families. So we've been working with the various clinics and addiction recovery centers to let them know we're out here, we can come and do education for your pregnant moms. It really is going to take, it takes a village to make this happen, and we are working with all kinds of other organizations to bring the very best care we possibly can, not only to the baby but to the entire family.